France, Germany and Italy joined several other European Union member states in halting the rollout of the AstraZeneca vaccine programme Monday.
Today's decision is a purely precautionary measure.
It follows Norway's announcement Saturday that one person had died from a brain hemorrhage and 3 others were hospitalised with blood clots shortly after receiving the jab.
So far, we cannot speak to whether the cases are connected to the vaccine, but due to the seriousness of the cases, we are investigating thoroughly.
Other countries outside Europe have also paused AstraZeneca vaccinations, including Congo and Indonesia. The World Health Organization says there is no evidence that the AstraZeneca vaccine causes blood clots and urged countries to continue using the jab.
Of the 330 million vaccines doses that have been deployed, we are not aware of any one confirmed COVID vaccine-related death. There have been deaths following vaccination in people, but people die of diseases every day.
Out of the 17 million people in Europe who have received its vaccine, AstraZeneca says fewer than 40 have developed blood clots. The vaccine is a key pillar of many countries' mass inoculation programs. It is relatively cheap and doesn't need to be stored at ultra-low temperatures. Nigerian health workers began to receive the AstraZeneca vaccine Friday.
We don't believe that this information is a reason for us to slow down our COVID-19 vaccination response.
Scientists fear the halt in vaccinations could hit global confidence in the jab.
It clearly has to be investigated. I think the big concern, though, is that we do know that even especially at a time when the disease is still actually very common and increasing across a number of European countries, that ultimately any delay in vaccinations will lead to more severe cases and more deaths.
The investigations into reported side effects could have unintended consequences, says Hunter.
One of the problems as well is that as soon as you start worrying about a particular adverse outcome, then more people are likely to report that outcome, and you can actually almost generate a false impression of an epidemic.
The AstraZeneca vaccine has just received official approval in Brazil, one of the countries worst hit by the pandemic. It has yet to be authorised for use in the United States. Henry Ridgewell for VOA News, London.